My name's Elizabeth Watts. I'm an emergency department nurse. I'm 24 weeks pregnant, and a month ago, I was forced to leave my job due to pregnancy discrimination during a COVID crisis. Finding out that I'm having a little girl really made me kind of want to bring more light to a situation like this. I don't ever want another pregnant healthcare worker or anyone to feel like they're disposable because of pregnancy.
Elizabeth, really inspired by your courage during this time. So much has happened, so let's start here. What was going through your head when you found out you were pregnant?
The first moment I found out I was pregnant, I was super nervous, super scared, super stressed. It was not something I was expecting. When the COVID pandemic started, I think every person, every healthcare worker, everyone is just on edge and they don't know what to do. The hospital that I contracted with had protections and policies in place for their pregnant workers. Those included keeping pregnant workers completely out of COVID rooms. For the first 4 weeks, those precautions and policies applied to me. Then one day I was told that I would have to take care of COVID patients or terminate my contract. And they had me on the EMS section, which was a 12-bed area that generally 10 to 11 of those patients are COVID or suspected COVID patients. I was very confused. I didn't feel comfortable exposing myself or my unborn child to COVID patients. The assistant director told me that there were no exemptions for me. She told me if I had an issue that I would have to take it up with HR. I actually went to work the following day, and as soon as I had walked in that day, they actually had assigned me the only COVID patient on the whole unit. I actually never heard back from my HR department. Since I'm contracted, I called my agency. The agency recruiter told me I would have to take care of COVID and suspected COVID patients, or they would terminate my contract without any ill will. Shortly after I lost my contract, I decided to file charges with the EEOC because if situations like this aren't brought to light, things are not going to change.
Now, what do you think that change looks like for these two corporations, MedStar and Medical Solutions?
MedStar should treat their contract workers equally as they treat their employees. My agency, Medical Solutions, should stand by their nurses better, but they stand by their clients because that's who they make money from.
Okay, but the hospitals are so overwhelmed because of COVID. Do you think they should get a pass here?
Protections that are in place in the healthcare industry for pregnant healthcare workers aren't just for times when there's nothing on the line. They're for times like this, during a pandemic or crisis. I've been in healthcare for 13 years, and I've never really seen HR or anyone really rally to help other pregnant healthcare workers. I think the way I was treated tells other healthcare workers that want to be mothers, you might not have a job.
It's a girl!
Finding out that I'm having a little girl really made me kind of want to bring more light to a situation like this. I don't ever want another pregnant healthcare worker or anyone to feel like they're disposable to any corporate or any industry because of pregnancy.
Thank you for watching. We need your help to stand up for Elizabeth and other pregnant workers during this time. Please share this video to demand that hospitals and agencies change their policies to protect their pregnant workers, including contracted workers, when it matters the most.